Hi everyone, my name is Heather Pimentel. I'm a student at Fisher College studying health information technology. I am here today to discuss physical therapy, what's the difference between a physical therapist and a physical therapist assistant, in which kind of settings a therapist can work in. A lot of my information came from clinical experience since I am a physical therapist assistant, and I also received information from the mass.gov website and also the APTA website, which is the American Physical Therapy Association. And according to the American Physical Therapists Association, right now, 70% of the physical therapists are women. It's a very women-driven field right now, and back in the early 1900s it was as well. There was a woman named Mary McMillan who was from England. She studied physical education there and came to the United States. She then worked with wounded World War I soldiers to restore their function. Her dedication to the field really prompted curiosity from other women, which they then came together and created the American Women's Physical Therapy Association, which later Mary McMillan was voted president for. The popularity of this field really increased after rehabbing all the World War I soldiers. And throughout the years, the occupation really transitioned and blossomed, and you can find a therapist in many, many different clinical settings. Some of the clinical settings you can find physical therapists are hospitals, long-term care facilities, which I currently work at a long-term care facility, outpatient centers. Those mainly focus on uh, sports medicine, things like that. Physical therapy after a surgery. A physical therapist can work in the school department. They can also specialize in early intervention, which is physical therapy for children under the age of 3. They really focus on a lot of gross motor skills, sensory reintegration, things like that. They try to make it fun for the kids. They go in the pool. They use all the toys to get them really motivated to participate in the treatment session. Physical therapists also work a lot in the patient's home. A lot of patients are not going to long-term care facilities or rehab or short-term rehab facilities, especially right now during the pandemic. They're just going straight home, and they can do their therapy in the comfort of their own home. Sometimes they do better at home. They're more comfortable in their own environment. In a lot of these settings, there are multidisciplinary teams, such as like a speech therapist, occupational therapist, physical therapist. However, the physical therapist and the physical therapist assistant work very close together. And in the state of Massachusetts, according to the mass.gov website, a physical therapist is responsible for creating the plan of care and overseeing the physical therapist assistant as they implement the treatment plan. So the physical therapist can create an evaluation regarding the patient. They will give the patient a diagnosis code. They assign treatment codes, short-term goals, long-term goals. They assess their strength, their mobility, their balance. And then according to the treatment plan, the physical therapist assistant comes in and treats the patient according to the goals assigned. So the main difference between a physical therapist and a physical therapist assistant is that the assistant cannot create a plan of care. They cannot do a discharge. They cannot do a reevaluation. The physical therapist has to do that. However, we are both clinicians. We are both licensed. We both had to sit for state boards exams. So we can treat patients for physical therapy in all these different clinical settings. This is one of the books I actually used during PTA school, and there's a really great quote inside by the author, who's also a physical therapist. Her name is Stacy Fruiton, and the quote states, "One of the core goals of physical therapy as practiced in the United States of America is to encourage and teach patient independence on every level possible, which I completely agree with that. Especially in a short-term rehab setting or a long-term care facility, you want to teach the patient to be as safe as they can be and try to obtain the highest level of independence they can so they can have that quality of life that they used to have. So in the presentation, we discussed Mary McMillan and who she was, what the difference of the physical therapist and physical therapist assistant was, and also the different clinical care settings a therapist can work in. I thank you all so much for listening. And remember, if you don't use it, you lose it.